Kitty Cat here. This video will describe the different types of phosphorus-lowering medications for people with kidney disease. Here's the lowdown. We get phosphorus from the food that we eat. And when a healthy person consumes more phosphorus than is needed, the kidneys will filter out the excess phosphorus. But when the kidneys aren't functioning perfectly, that phosphorus can build up to dangerous levels in the blood. Normal phosphorus levels will be between 2.5 to 4.5 milligrams per deciliter. And when a person's phosphorus increases over 5, they're usually started on phosphorus-lowering medications or placed on a low phosphorus diet or both. Actually, it's usually both. If you need more information about low phosphorus diet, please check out my All About Phosphorus video because this video is only talking about medications. Currently, there are a handful of phosphorus-lowering medications on the market, and they are all binders. But there is at least one medication seeking FDA approval that's not a binder, it's an inhibitor. And I'll talk about that one at the end. But first, what do I mean by phosphorus binder? Well, it means that there's something in the medication that will grab or bind itself to the phosphorus in your food, preventing that phosphorus from being absorbed by the body. This medication should be taken immediately before or right after you start eating a meal for the best effect. Some people have to take their binder medication after the meal because of their nausea, they can't get rid of it. That's okay, it's just not going to be as effective. And yes, the illustration that I'm showing is an oversimplification. I just wanted you guys to have an idea of how it works, not to be experts. And yeah, if your phosphorus binder medication dose gets higher, it does have better phosphorus coverage. Usually your doctor will start you off on this smallest binder dose at first. This would be like taking 1 tablet or pill before each meal 3 times per day. But as time passes, your doctor might ask you to adjust your own binder dose. For example, you might take 1 tablet before snacks or before a small meal, and then take 3 tablets before a really large meal. If you're just starting out though, just take as the doctor prescribes because you don't know how you're going to react to these medications, and your doctor's going to want to see what the effects on your blood levels are first. And if you're wondering, yes, your phosphorus can drop too low. So let's talk about the different types of phosphorus binders. The first one is aluminum. I'm talking aluminum hydroxide or Alternagel, also known as Ampogel. The safety of aluminum binders was called into question in the 1980s due to aluminum-related neurological and bone disease. Kidney disease clinical practice guidelines recommend against using these aluminum-based binders for that reason. However, it's suspected that aluminum-based binders got a bad rep because back in the 80s, the dialysis fluid was quite high in aluminum. And nowadays we do rigorous water testing for our dialysis machines, and that problem is no longer a common one at all. And there's some suspicion that back in the day, that dialysis fluid was the real problem, not the aluminum-based binders. I just told you that long story because if your doctor orders you an aluminum-based binder, I don't want you to be that concerned. Know that it's affordable, it's well tolerated, and it is very effective. And the doctor will be monitoring your blood aluminum levels, and you'll be stopped from taking the medication if your aluminum gets too high. Calcium-based binders are the next type. I'm talking calcium carbonate, otherwise known as Tums, or calcium acetate, most commonly found as Phoslo or Foslera, and there's a third one that I can't remember the name of. Remember those kidney disease practice guidelines I was talking to you about? There's one that's the global one, that's the KDIGO one, and there's the KDOQI one, that's the US one. Well, they recommend against the aluminum binders. They're also recommending avoidance of these calcium-based binders. And the reason for this is our evolving understanding of cardiovascular disease and calcification that might be happening because of all this calcium intake. So it's recommended that blood calcium levels be monitored, and any of these calcium-based binders should be stopped if your calcium level gets too high. But There's a lot of evidence that's showing that even if your calcium levels look good when we check it, that doesn't mean that there's not calcification damage happening. So in my opinion, it might be different from your nephrologist. These calcium-based binders are great, but they shouldn't be given in high doses, and they definitely should be stopped if your calcium blood levels are looking high. That said, these binders are very affordable. The calcium acetate, that blue and white one up there, that's easy to swallow, so people like that one a lot. And the calcium carbonate can be chewed, it can be crushed, and it is extremely affordable. The most common symptom or side effect is GI distress. Just like any of the phosphorus binders I'm about to tell you about, GI is the biggest issue. Your doctor or pharmacist will advise you on other common side effects or contraindications for this or any medication I mentioned in this video. The next type of phosphorus binder are polymers or resins. An example would be sevelamer hydrochloride, also known as Renagel, or sevelamer carbonate, called Renvela most commonly. These binders are decently effective and they don't pose a real safety risk like the other binders. Most insurance companies will be happy to pay for these medications for you without a fight. But if you don't have insurance, you can always go to goodrx.com and print out a coupon that you can use at your local pharmacy instead of using your personal insurance. Or you can go to Mark Cuban's Cost Plus Drugs website. It's an online pharmacy. They mail medication to you. That is the cheapest place in the US to buy sevelamer carbonate if your insurance company doesn't cover it. Common side effects are GI related, just like the others, and also these pills are rather large. You're not supposed to cut them in half, you can't crush them, you have to swallow them whole. So if you're not able to swallow these large pills, tell your doctor there is a powder version of this medication. It's more expensive, it's harder to get your insurance company to cover, but you can do it. The next type of phosphorus binder is lanthanum. Lanthanum carbonate, also known as phosrenol. I love this product because it's a tablet or a powder. It's easy to chew and it's pretty well tolerated. And I wanted to point something out. Except for the sevelamer binder that we just talked about, all these other phosphorus binders are metal-based. Aluminum is a metal, calcium is a metal, lanthanum is a trace metal. And hey, I'm about to talk about iron and magnesium. Those are also metals being used as phosphorus binders. The concern with all of these metals is that they're possibly being absorbed little by little over time, and it gradually accumulates in the blood. For this reason, even the lanthanum, I'm going to say you don't want to do a high dosage of it for too long. The next type of phosphorus binder, as promised, is the iron one. And examples include ferrous citrate, like Auryxia, and sulfoferric oxyhydroxide. That's a mouthful. I'm just going to call it Velphoro. Both of these medications are effective, and they require much smaller doses than most of the other binders. A fancy way to say this is that they lower your pill burden. Ferrous citrate, that's this little small pill up here. Very easy to swallow. I love it. Another one is the Velphoro. It looks like the size of a Tums. It can be chewed, it can be crushed. These are both great medications. They're like the Cadillac of medications, but there are several downsides. The first downside would be the cost. Because of this, most insurance companies will make getting a prior authorization for these medications difficult for you and your doctor. You might have to be tried and failed on several other binders before they will finally open the purse and let you get this one. Check out these companies' websites to see if they can get you any assistance with the cost. Another downside is the GI effects. If your doctor has any free samples, please ask for them, because you want to try this out before you go through the rigmarole only to find out that you can't tolerate these binders. If you've ever taken oral iron supplements, you might have an idea of what this could feel like in your body. The taste of that Velphoro, the big tablet medication, is also a common complaint, which can be remedied by breaking that tablet up into little pieces and then swallowing those pieces whole. Instead of just popping that tablet into your mouth and chewing it up for a long time, it leaves like a film in your mouth that doesn't taste the best. The final downside, I think that you've already got the idea of. We have to watch your iron levels in the blood. The Velphoro, the big tablet, is much less of a concern than the little pill, the Auryxia. Auryxia might bring up iron levels, which, hey, could be a great thing. If you're iron deficient, that little pill can do double duty, iron supplement and phosphorus binder, right? I have just seen plain ferrous sulfate, which is a common iron supplement, being used as a phosphorus binder. I've heard of magnesium being used as a phosphorus binder, but those are in rare instances. And all of these possible phosphorus binders out there make management more of an art. And I've had a lot of patients that don't like any one particular binder and end up taking several different kinds. They might take one tablet of this and one tablet of that before every meal. Or they may take this type of binder before breakfast, but then they take a different type of binder before lunch. And that's fine. It can reduce your pill fatigue. That's where you get sick and tired of taking the same medication 3 times a day, day after day, year after year. So this type of binder management, it's not unheard of. It's not unreasonable. And it might actually lower some of the GI effects, and it might lower your risk of any level getting too high in your blood. Finally, there's a new type of phosphorus lowering medication on the market, and it's not a binder. It's an inhibitor. And the name is tenapanor. I might be butchering the name, I'm not sure. Apparently, it was an IBS, irritable bowel syndrome medication. They just happened to realize that it keeps the gut from absorbing too much phosphorus, which sounds wonderful. And if it gets FDA approved, I just have to caution all of us, the cost could be prohibitive, at least at first, just like any new medication. It's usually very expensive. And then also looking at the study, they were using this tenapanor medication in addition to phosphorus binders. So I'm wondering, is that just going to increase the pill burden? Or maybe it can, we'll find out it can actually be taken instead of phosphorus binder. That would be great. But as we find more information, I'll let you guys know. That's it for this video. Again, please check out my All About Phosphorus video where I discuss the real problem with phosphorus control, and that's phosphorus additives in foods. If you like this video, please give it a thumbs up. If you need more videos like this in your life, subscribe. This is Kitty Cat saying goodbye. See you next time.